Welcome to Marney Reid Presents Connect to Develop, where we provide insight from healthcare leaders on the hottest topics and trends. Hello, everyone. I am really honored to introduce you to Roen, Vice President of Professional Relations and Fellow Strategy at Smith+Nephew.
Hi, Marnie. Thanks for having me. Happy to be here.
Oh, excited for this discussion. So, Anne, you have over 25 years experience in healthcare. You must have started when you were 12, building and developing relationships with both internal stakeholders, so people you work with in the organizations, and external ones. So in the instance of your career, physicians. So let's start with the internal stakeholders. Can you tell us about how you approach networking and building relationships with peers?
Yeah, of course. I think I approach networking and building relationships with anyone the same way, with a genuine interest in who they are, what they do, and how I can learn from them or help them. For my internal peers, I really try and understand what the person does and how our roles interact today or possibly could or should in the future. People's roles change, our business needs change. So I have found it to be really valuable to know people from across the organization. So when a need arises in an area that I'm unfamiliar, I have someone to call or at least point me in the right direction. And I always try and reciprocate. So when someone reaches out to me for guidance or advice or, for help, I have a diverse background. So I've been in sales, I've been in sales leadership and marketing, professional relationships. So I've interacted with pretty much anyone in an organization in some capacity over my career. So I usually can point someone in the right direction or know someone who can. And so I like to help others and use my network for that reason. And I try to provide value in every exchange that I have with people, or at the very least, not waste anyone's time.
Are you utilizing things like conferences? Your companies go to these huge, industry conferences, and there's a lot of different people from various areas of the organization. If there's someone out there trying to ramp up their internal stakeholders, how do you suggest they reach out in a very authentic way where they feel like they're, about to add value, even if it's simply just to get to know them and what they do?
Yeah, conferences are a great way to do that because people are all in the same place. And even individuals that I live in the same town with that I don't see very often, it's like, let's grab coffee when we're at Academy or at a MedEd event. The other thing I do is when I'm in one of our offices, Smith+Nephew has three different offices, four really in the US. And when I'm in those offices for work, for meetings, I try and reach out and have lunch with individuals that I don't get to see very often. Or, I have those hallway conversations that we used to have when everyone was in the same building and we all worked in an office together and things like that. So I definitely think it's important that if you are in the same vicinity of someone, take advantage of that. And even if it's a 15-minute hi, let's grab coffee, or, a full hour of let's dig into some problem that we've been working on virtually or remotely. Because, as wonderful it is to have conversations over Teams and Zoom, and there's nothing that beats in person, in my opinion. And I might be old school because, as you said, I have a lot of years of experience. It's just, having conversations are so much easier and so much more effective when you can read people's body language. And, especially if there's more than two people in a room, be able to have those interactions. So I love going into our offices and I value them and I try and maximize my time when I'm there.
I agree with you that you just can't beat in person, especially too with, challenging situations. Someone that traveled 25 to 31 days every month for 7 years prior to COVID. And then COVID hit and you got really used to, the Zoom and the Teams calls. When you ramped back up out of COVID, there were certain conversations where you sit there and you think, this needs to be done in person. I need to be able to see the body language and look them in the eyes and, workshop this or, share this. So I don't think that's old school. I think that's just realistic. The politics of large companies like the ones you've worked at, that you still work out, have to be challenging to navigate. So, can you talk about tips on how to assess and manage inside the matrix as you build out a program or initiative where it's maybe a new idea or you're trying to iterate on something that's already there?
Yeah, I mean, I think navigating most organizations can be challenging, but when you have large matrixed global organizations, it can really be a little daunting. And going back to my comment about, building relationships and networking internally, I think the key is to intentionally build and understand what people do in the organization. So it's not about titles or politics. It's really understanding how your organization works and where you fit in. So I joined Smith+Nephew almost 2 years ago. And one of the first things I did was set up one-on-ones with my peers in each of the business units, each of our regions around the world, and different functions to really understand how things get done within the organization and to see like where do I fit in and have them understand where I fit into their world. So anytime I want to build something, try something new, I need to understand how that would fit into my organization and where the value would be. And so being able to reach out and talk to individuals about, the initiative, if you would, or the function or the change and get their feedback while I'm developing it or while we're working on it is valuable because there's a lot of stakeholders. And any time you make change or build something, it affects a lot of different people, both positively and negatively. And, in a global organization, different cultures around the world see things differently. And so if it's something that I'm going to be doing that's going to have a global impact, I need to truly understand how it would be perceived or utilized, or if it's even possible outside the United States. I try and have a very global view of everything I do because I do have a global team. And we do tend to get very US centric at times. And sometimes I have to intentionally get my head out and of that and say, you know what, this is not just in the US. Let me go and talk to my people and talk to others about how this would impact them in their world. And even to this day, if I get an email from someone or a meeting notice from someone I don't know, the first thing I do is I look them up in the org chart to see what business unit are they in, what function do they report to, and that helps me better understand the context for what they're asking or needing, and it helps me frame my responses a little bit better. So I think it's really just about knowing your organization and how what you're trying to do will impact not just you and your team, but the whole organization.
As I sit there and I'm thinking about all of the work that it takes, I have to assume that when you start, you probably took quite a while, maybe even before implementing that whole, first 90 days concept to just really learn and kind of, sit at the table and let people get to know you. But as you scale things, that sounds like a very challenging thing to do is to put any kind of process or system around what you're doing because of, to your point, the various cultures, the various impacts to different people and their business units. How do you create any kind of system or process to be able to scale?
Well, the first thing I have to do is get buy in from leadership. It's much easier to make change and create different value if you have support of individuals that hold the checkbook and can help bring that message down within the organization. And so I think the last year we had a pretty major change in my organization around how we do HCP engagements and the system we use for contracts, honoraria, and it was global. And one of the things we had to do was really get buy-in from our leadership to help drive that need and drive the importance of what that's going to do for our organization. So I start there. And sometimes it's a matter of getting data and doing interviews with my peers and with my team to build up the case. It's really about building a business case, if you would. And to do that, you need data. You need to be able to have not just anecdotal data, but if it's financial, if it's percentage, if it's customer facing, anything that is tied to customer experience and improving that experience, I think has a better chance of being implemented or being accepted because we all want to have good experiences and we all want our surgeons and our customers to have good experiences. So if you can tie anything back to that, I think that's helpful. And in my experience, that's where I've been able to have the most success driving change and building different initiatives in that the impact it has not only on our organization, but on our customer and patients. Tie it back to our patients because that's why we're all in this space. That's why you're in healthcare is to help treat patients and make people's lives better.
Could not have said that better. To the point you make about, the various roles that you've had from sales to sales leadership, marketing, professional relations, there's had to have been a genesis in not only the way that you execute, but the way that you manage up, down, cross functionally. Can you talk about that journey?
Yeah, I don't know how intentional I have always been in building some of those relationships. And I say that in that I know a lot of people who are great at managing up. I think for me, I started my career in sales. And so I've always just been a person that has that. I don't want to say I'm a people person, but I'm a people person. And so I think building relationships and just having access, I've been very fortunate in my career. One of the roles I had when I was with Medtronic, when I came into the organization, is I ran all of our advisory boards. And so just by the nature of that role, I was interacting with our senior leaders and I was interacting with our R&D and clinical and marketing. So I just had built relationships with a lot of different people throughout the organization just for the nature of my role. And so part of it is access. And if you can authentically and organically have access, then I think your senior leaders will appreciate that and understand the value that you're adding to them. I think people know when you're just trying to suck up to them. I do genuinely believe that most people have a good sniff test on that. And so if you're doing it for the right reasons and having and building those relationships with senior leaders for the right reasons, I think it'll have a much better impact than if you're just there to be in front of them and have FaceTime. So, but it is important to just be yourself and try and provide value or at least information. Back in my sales day, whenever our senior leaders would come to town and want to go visit customers, the first thing I did is just provide them with an overview. And so, what kind of information do they need? Do a four blocker. Make sure you are prepared. Make sure you can anticipate some of their questions and not waste their time. So, I really think it's important just to think about that person as what is their goal and what do they need to do their job. And if you can help with that's fantastic. But I do think it's important, especially in matrix organizations, to know when to stay in your lane and when you can merge with others. When I think about some, whether it's projects or access that I've wanted, I don't necessarily, I think it's important to provide your insight and input in areas that you have expertise, but you do have to be careful not to overstep or be critical of other people's work or projects because you don't know what that person's relationship is to either another individual or to a project that they're working. So I kind of have a rule that I never want to call anyone's baby ugly. They may find it to be beautiful or they may think that it's the most important project of the company. And so, you kind of have to know your audience and what's important to them and where they came from.
That makes sense. You mentioned four blocker. Can you expand on what that is?
Oh, sure. When I look at information that's important, I look at, it's whether it's a SWOT analysis. So, what's the situation? What are the weaknesses? What are the strengths? What are our opportunities? What are the trends? When it come to an account or when I had senior leaders coming in, I would build a spreadsheet or a PowerPoint that just had here's the current state of the customer. Here's what our competitors are doing with them. Here are the key people. And here's what our goal and agenda is for the day. So, you look at it, four blockers can offer a lot of different value. I think anytime you get more than four blocks, it gets to be pretty complex. So you really just want a one pager that says, here's what we're going to do. Here's the background. Here's some traps we don't want to fall into. Here's the history. We may have had a great history in the past, or we may have not had a great history in the past. And so I think it's good that you prepare, whether it's a leader, whether it's my peers, whether it's my team. Everyone needs to know what the situation is, and having a one-page document that provides all the information is very valuable. So I love it when people provide me with that type of information because I'm going to ask. So if I come in and someone just provides it to me without even having to ask, I think that's fantastic. And that way we're all prepared and we can all have a better experience.
That's a great summary of, being in orthopedics and also, having sat in so many corporate rooms. The second I heard four blocker, I then heard, the blocking and tackling. I thought, she's definitely not tackling people four times. Tackle, is she getting, tackled and has to block four times? So that was an awesome explanation.
Well, but you bring up a good point. We do tend to fall into traps where we throw out acronyms. We throw out phrases that we just assume everybody, and it's like speaking a different language.
Yeah.
And so that's you called me out on that, and that was good because I think we all fall into that trap and we just assume everyone knows what we're talking about, including our customers.
Yeah.
Uh,
Yeah.
Customers love to make fun of us who work in large companies because we do have a lot of, three-letter acronyms or,
Yes.
TLAs, as we like to call them, because you have to have an acronym for the three-letter acronym. But
I love the acronyms. I use them. I'm glad that you have an acronym for the acronym. I think
oh yeah,
that's, key for every office. So let's now pivot and let's move to pivot's another one too. I think
oh yeah.
there was a point in COVID where I'm pretty sure if I said pivot one more time, someone was going to smack me through the Teams chat. What's it look like when, let's start with a future customer, you're trying to build that relationship? What kind of meetings are you having? What are you looking for? What are things where you say that's just not going to happen? We're not going to work with, that person if, that does happen to you.
Yeah, I think it kind of starts with how I got connected to that individual. So, in some instances, a salesperson will reach out to me and say, my doctor wants to talk to you about XYZ. They want to talk to you about fellows. They want to talk to me about, medical education, something like that. So, I sort of utilize the where did I meet this individual as my guide to how I want to pursue or how I want to move forward. But the first thing I do, I would say, is I do a little my own research. Where did they go to medical school? Where did they do their residency, fellowship? What kind of practice are they in? So I think it's important for me to know a little bit about them before I have a conversation. And then I like to just ask basic questions like what is their practice dynamic? What is their procedure mix? Information that maybe I can get online, but it's always good to hear from them. And at this point of time, where are they in their work, in their practice, in their procedures? I like to throw in a little bit of personal. I think it's good to get to know someone, their family, do they have kids, their hobbies, because, people are people. And our lives really will frame the work that we can do. But then I like to just ask them or find out from them what kind of relationship do they want to have with me, or what is their goal? Is it that they want to start doing more research? Do they value teaching and education? Do they want to have relationships with our senior leaders? In a previous world, I was in professional relations, and it was funny the number of times I'd have a field person come to me and say, "We want to connect them with, our CEO or with the president of this division." And I'm like, "Okay, let's figure this out." And so we get there, I introduce them, and the rep wanted them to have a relationship with our senior leaders, but that physician really wanted to talk to our scientists and our research people because they were very technology driven and they found more value talking to one of my research folks than they did our senior leader. And so it's good to validate why I am having conversations or what that individual really wants to learn or wants to do with my organization. So always talk to the individual to find out what is important to them. And then from there, look at, what is the path forward? Is there something that we can do a local program with if you want to start doing more education? So I like to really just kind of get to know that individual and what motivates them and what capacity they have to have a relationship with us. As I mentioned, not everyone can travel and do, education or be on a podium. Some people want to do more things remotely, and that's okay. So really just finding out what they want and how what their end goal is. That's really important also, because if they're mid-career and they want to be society leadership or on a design team, that's a very different conversation than if they've been doing this for 25 years and their goal is really to stay relevant or to be more nurturing or even to take a step back and do less. So it's really finding out from them what they want to do.
That's some great points. And let's continue down the path of tranching out where they are in their career and what their goals are. So, for the surgeons out there listening, let's say that you've got someone who's fully board certified, they've ramped up their practice a few years, they feel like they've gotten, things kind of under control, and maybe their goal is to be up on podiums, to be seen teaching for companies, with products that they really passionately believe help their patients. And maybe they even want to get involved in the societies and some kind of leadership. What does working with them look like?
Yeah, that's a great question. And I get that asked a lot. And I think it really starts with leveraging your local rep, because that's where a lot of relationships start. Is the local rep will reach out to me or my peers in medical education and say, I have a surgeon who has an interest, and this is what they're interested in, this is what they're doing. Oftentimes it's the rep will also say, I think they'd be really good here, because the reps know them, they see them doing local stuff. And so one of the things I always recommend is, let's meet at a congress. I'm always happy to come out and meet a customer as well. But the other thing that I think is highly effective is have the rep bring them into for a headquarters visit, for a customer education visit, so that they can see what my organization is about. So, at Smith+Nephew, we have the ability to bring people depending on what specialty you're in. We might bring you to our Memphis office, where we have our orthopedic and recon and robotics R&D and leadership. And so come in, meet some of the marketers, meet some of the medical education people, maybe even meet our leaders, and just kind of get to know our company a little bit, and we'll get to know you. And so it's really almost dating, if you would. Bring them in, have that introduction, and then from there you can talk and learn more. They learn more about us, we learn more about them, and then put together a plan. And maybe that plan starts with, let's try and do some local programs together. Typically, if it's an individual that we just don't know well, or is maybe earlier in their career and hasn't had the CV's not quite as long yet, it's always good to I don't want to say test them out, but that's kind of what we're doing, is do some work with them on a local or regional level before we move to a national or international type of podium from an education perspective. But it really all starts with just understanding, having that individual learn a little bit about us, and we'll learn a little bit about you. And I think a great way to do that is to bring them in and have them meet more people.
Completely agree with starting them locally, because that actually does a lot to help, quite frankly, protect and develop them. I mean, not everyone has podium presence from day one. Very few people get up there and you watch them and you go, yeah, we're going to do this again. Oftentimes there's a lot of coaching. Let's talk about this. I myself have been fortunate enough to reach out and ask some surgeons after I've seen them, present and run some programs, if they don't mind some coaching, and they've been extraordinarily amazing and humble and willing for that. How much coaching do you and your teams do for those earlier career surgeons, where you go, they've got the work ethic, they've got that star quality, they're doing it for the right reasons, but they really need to work on their podium presence? How does that conversation or that, journey for them go?
I think it can go one of two ways. One is, we can sit down. I've had conversations with them, especially when they've asked. So if they're asking me for my feedback, I will always be 100% honest. And to provide them with specific examples, like, you were on the podium and you framed the comment like this, or your tone, or you were walking too much, and I like to give specific examples, because that gives them something to work on or something to notice. And maybe it's, if we're videotaping, if it's a program that we are recording, let's watch it together and talk about it. And I think that's very valuable.
Yeah, game day footage.
Yeah, and watch other people. So it's always good to say, well, how Dr. So and so, when he does it, he says this, or his slides have these type of information on it. Sometimes it's the content. Their content might be really good. It's just not packaged well, if you would, because they don't go to medical school to build PowerPoints.
Correct.
And that's okay. But I think, just having those one-on-one conversations and that coaching is important, but also mentoring, connecting them with a surgeon who may not be much farther out from their career than them, and having them kind of sit down with them and say, this is some of the things I've done. And that's been really helpful as well, is just to try and provide a little mentorship, if you would, and someone else to provide them with information who's been in their chair. And that's always good. I mean, I'm sure you have as well. We've had wonderful mentors over our careers, and they've helped me enormously. And so just being able to have that honest conversation with, industry as well as another surgeon or physician who is in their space is extremely helpful.
Yes, mentors are key, and I love the approach that you take with them where, you sit down with them, especially if it's recorded and watch it together. I think that would really resonate too, especially with how sports heavy orthopedics, specifically is. I would have loved to have seen how that went for you with some electrophysiologists back in the day at Medtronic.
Yeah.
Probably two different types of conversations right there.
And some people are better, sorry to interrupt. Some people are better one-on-one in a lab
Yeah.
and teaching than they are on a podium. And that's something that we will talk to them about. We would love to have you as part of this. We're going to have you do a case, but then we're going to have you do hands-on work in the lab, because if that's their strong suit, then we definitely want to work with them, but we want to work with them in an area that both of us are comfortable with. And they may be more comfortable in a one-on-one situation or three-on-one situation in a lab. So it's just really figuring out how best to utilize them to get the best result for the program and for everyone.
Can you walk us through, and especially for those, this is going to, I hope, enlighten the surgeons in understanding the interactions when they want to work, with an organization like yours, on the interactions they can and can't have with sales versus marketing, medical education, et cetera, and why. And then also for those people who maybe are going in from sales, transitioning into a corporate role, there were things that I learned very quickly through the fire when I went from sales into medical education back in my industry days. Can you talk about what that was like, the conversations you can have with surgeons, the things you need to step out of when it gets into that conversation when you went from sales into, marketing, prof ed?
Yeah, no, great question, and still a very relevant topic every day. There are rules, and some of the companies I've worked for interpret those rules more conservatively than others, and so you have to think about that as well. That what my organization will allow and what it doesn't is based, obviously on Advamed and some other rules. But what my goal always is to not make the salesperson they're the messenger. So whatever conversations we have with surgeons and stuff, we don't want it to jeopardize their relationship. And so some of it is framing the this is why your sales rep can't be involved in clinical research. When we talk to individuals about consulting and design work, selection of our faculty, our salespeople are allowed to nominate, if you would, or to make us aware of individuals who have an interest, but they're not able to be part of the selection process. So that's tied to medical education. So our medical education and or our marketing teams have the final say on selection, but there's nothing wrong with a salesperson identifying and raising their hand and say, hey, you should come meet this person. So that's okay. But once it comes to the selection, anytime there's honoraria or compensation tied to it, the field really does need to take a step back. And because we don't want it to appear to be an inducement, even though there may not be any intention of that, it's all about perception in that way. And we have to make sure that there's no perceived inducement that we will put you on the podium if you buy our products. And of course, that's never the way we interact, but that is why we have some of these rules, is because the general population may not understand that. And so I always look at it as, if this was on the front page of the New York Times, how would the general population perceive this. And so if it is positive, then great. There's probably nothing wrong with what we're doing. There's kind of like a doesn't pass the sniff test, then we need to take a step back. And so just having the conversation and reiterating with them about some of the things we can and cannot do and the why. Oftentimes we just say, well, we're not allowed to do that because of AdvaMed. And that might not be a good answer. It might be, your sales rep can't be involved because we're having conversations about products that aren't on the market today and they're not allowed to sell it. So we don't want to put them in the situation that they are, sharing information about products that are not FDA approved and that type of thing. So sometimes if you just explain it to a surgeon, they're like, oh, that makes total sense. Yeah, Jimmy should stay home. But I also think that also makes it more special because, if we are not allowing the field, or if the field can't be part of a conversation or needs to step out, then that surgeon knows that we're talking about something that not a lot of people know about or haven't had the privilege of being brought into the fold on something. And so there's different ways of looking at it and different impact that it has on individuals. And so one of the reasons we have people sign confidentiality agreements is you might be telling us something that you don't want us to share, and we may be telling you something that we don't want you to share. And so just that openness and the freeness of being honest and candid and providing more information than you would if you were sitting on an airplane and, your competitors were next to you or someone, it really tries to foster that candor and the honest and open relationship. And so sometimes that means that, the individuals that you see every day when you're doing cases can't be in the room.
I really like what you said about perception. I think that's one of the things. I've definitely been privy to emails where I see a surgeon send over something and I immediately text them and say, please call me as soon as you can. This is not life threatening urgent, but please call me. And they just don't know. They're not trained to understand, why saying something this way could be perceived that way. So I found that taking time, to just have that conversation on the phone with the surgeon about, hey, be careful how you phrase this because if it's interpreted as such. And I found that surgeons are very grateful for that insight because they're not groomed on these things and no one's trying to get someone else in trouble or be called to the carpet. So I really like that. And I also like the idea of not just saying because of AdvaMed. It's like telling a child because I said so, really digging to why they can't, you know, can you share maybe some of the pitfalls that you've seen industry executives fall into when they're trying to build and manage relationships with physicians?
I would think the number one pitfall is making commitments or promises that we may or may not be able to fulfill. So it is hard and it's a challenge. So whenever we have, leaders meeting with different customers, sometimes things, so they, you get excited or you have really great dialogue and you're like, yeah, we should do X, we should put you on the podium. You should be part of this, focus group or advisory board. And then, in actuality, it's harder to make happen. It's harder to execute than they may have known, or there may have been reasons why we don't have that individual doing certain things. And so that what I would say is the number one pitfall that we fall into is just making promises that are challenging to commit to, or that the perception of what they said is different than what the intent was. So I think those are two different things, obviously. But, if I'm I think it's human nature. If I'm being told something by someone who has authority or who holds the checkbook or who I find to be, the leader, then I will take that as gospel, or I might hear something, but it's not necessarily what their intent was. And so that's always something you have to be very careful with. And that I think our senior leaders they learn that. Sometimes they learn it the hard way, but they probably learned that when they were at a different level as they were coming up in the organization. They probably had to go try and figure out how to make something happen because someone else made a commitment. And so I think that is one thing that we all need to be cognizant about is there's always, perception's reality. And regardless of if your intent was A and the surgeon or the customer heard B, we have to figure out what B is and if that's possible.
I personally am a huge fan of documenting. And so just that recap, thanks so much for your time. This is what we went over. These are my action items, because then you have something to go back to if someone feels like they were told, something else. And then to your point, as someone who my livelihood depended on my surgeons, having someone coming in from corporate, especially if they were marketing or R&D or even just had a big fancy title, that could really elevate or put me in a bind afterwards based on if my physician, felt like something was supposed to happen and it didn't.
You
So
didn't. Yeah. Yeah, the
really,
follow-up is key. You are 100% correct. The follow-up
yeah.
and making sure that, even if it's let's stay connected and then they never hear from them until the next year. So there has to be that expectation setting that's appropriate and really, living up to those expectations, because you're right, that can do a lot more damage than good. And at some point then they're like, "You know what? I don't even want to meet with that person anymore."
So if you could sum up for our listeners out there, 2 to 3 key recap pieces of advice on building and managing internal stakeholder relationships, what would they be for our listeners?
I think the first is to be authentic. I know it's a cliche, but to truly build relationships with internal and external stakeholders, you really need to be yourself and not what you think others want you to be. I think that's number one. I think next, I would say be accessible. Take people's phone calls or informational interviews. If someone reaches out to you, respond. Provide the input and help that they ask for when it's appropriate, because that will help build some value, and it also will help build that relationship because they know that they can rely on you, or they know that what to expect, if you would. And so definitely be accessible and responsive. And then I think another would be to help connect others. I try and connect individuals who I think may be able to help one another. Like you and I have had conversations where it's like, you should really talk to this person because I think you two would either get along really well or could really help each other. I think there's synergies there. And so I do think it's important, as we go through life, to really help connect our peers with one another, whether they have similar roles or maybe their functions could benefit from one another. If I'm at a third party conference and I'm talking to one of my colleagues and, you walk up and I say, "Oh my gosh, Marnie, how are you?" I will always introduce you to whoever I'm standing next to. Whether you will ever meet that person again, it doesn't matter. But I think it's just really important that we connect, always are trying to connect individuals, because you never know when, someone's going to connect you, and that becomes, one of the most important relationships you have in your career.
Absolutely. That's, I think, the definition of the relationship networking mentality versus transactional. So,
Exactly.
how about advice for the surgeons out there listening who are looking to work with industry? As you know, because I've told you to be a panelist for the Working with Industry dinner that we do at the Foundation for Physician Advancement. That's one of our most popular sessions. Advice, 2 to 3 biggest tips you give to any surgeon out there that wants to get more involved with industry on any kind of level.
I think, some of my advice from the internal really apply to physicians as well, is be authentic. We want the reason we are asking to work with you is because there's something we see in you that we know will resonate with others. So whether it's the way you practice, whether it's your personality, the experiences you've had, definitely be yourself and bring your true self to the table, because that's what people will respond to. I think the accessibility piece also is important for physicians who want to work with industry. If it's not a good time in your life and you have a lot going on and you're not going to be able to participate in, pre-calls or, attend an entire 2 day program, that's okay. Let's regroup, in 2 years when you are able to do something like that. So I think the accessibility and being easy to work with, and by easy to work with, responding to requests, especially meeting deadlines. So if it's an education program and we need your slides by Tuesday, please give us your slides by Tuesday. Because at the end of the day, when we look at faculty, while expertise and experience is important, it's also who do we like to work with and who's easy to work with and that we don't have to go chase things down or be concerned about what they're going to say. So that type of just structure is really important and really helpful. And then lastly, I think just, stay up and current on what our organization does. And that could just be, once a year, twice a year, make sure that we have conversations, whether it's, doing a visit to our headquarters or having us come out and watch cases or spend time in your practice. I think it's just really good to keep that relationship beyond just the, one or two times a year that you're on a podium with us, and just really understanding who we are as a company and what value is we see and what is important to us. And we will obviously want the same from them. So I think those are some really important keys, but definitely, make sure you get things in on time.
For the surgeons listening out there, especially when it comes to slide decks, those have to go through a pretty rigorous review process. So they're not just asking you to get your deck in early because they want to make your life harder. They have to have time. And if you're the surgeon who, when compliance and legal and regulatory and marketing sees your name on a docket and they go, oh, we're going to be working on Friday at 11 p.m. because they're not going to get their deck in, you might not get asked back a lot. So agree with all of those. Well, Anne, this, as usual, was extraordinary. Thank you so much for your time, your candor. Cannot wait to see you at the next Congress. For those of you who don't know, I too learned Congress means conference. So, Academy, NAS, those things are all congresses. Thank you, Anne. This was incredible.
Thank you. I appreciate it. And I look forward to more of your discussions down the road.
Thanks for listening to Connect to Develop. You can find more interviews and Marney's Minutes on my YouTube channel at Marney Reid Presents.